All right, back on the Young Turks. Now, we had seen a story. Actually, in fact, Thom Hartmann did an interview with Gavin Newsom, where Gavin Newsom said they have a public option in San Francisco in the city, and that it costs the average person about $279 to join. And I found that amazing. And so what we want to do is check with some of the local reporters there to see if that's actually true before we started quoting it. So in an effort to do that, we brought on Carla Marinucci from the San Francisco Chronicle. Carla, thanks so much for joining us on the Young Turks.
Hey, thanks for having me.
All right, so first, let's talk about whether San Francisco has a true public option and what that means. What is it exactly in San Francisco?
Well, San Francisco has established a national first. It's called Healthy San Francisco, and it is a public option, providing basically affordable care to the uninsured. It doesn't matter employment status, immigration status, pre-existing conditions. It was begun in 2007 experimentally, not without some controversy, but it requires employers with 20 workers at least to provide health insurance. They set up health care accounts, they pay into a city fund, and the mayor is correct. A recent independent study did show that the average cost per person each month is $280. Participants pay that cost out of pocket.
That sounds amazing. In a city as large as San Francisco, and where costs run out of control sometimes in the bigger cities, $280, I'm not wrong. That sounds like a pretty reasonable amount for health care insurance, right?
Yeah, and the Mayor Newsom has really used this as sort of the centerpiece of he's running for governor, but this is something he does sort of have bragging rights to. The Healthy San Francisco program has expanded. It's now helping 38,000 people who were previously uninsured without health care, which is a considerable number. I mean, as you know, in California alone, there's something like 6 million people. 1 in 5 do not have health care. Newsom said it was time to do something about it, and he wasn't alone. There were other people on the county supervisors, the city and county of San Francisco, the supervisors who worked with him on this. But the thing is, it has been very successful. It's enrolling new residents at the rate of about 600 a week or so, and at least the mayor's office says this is on pace to cover the majority of the uninsured in San Francisco by the end of 2010. That would be a pretty amazing feat if that happens, and it does look like it's on track to do that.
Let's go into some of the details here a little bit more. I don't know if you're going to know, of course, the answers to all these questions, but let's do the best we can because, of course, we haven't talked through what parts you do and don't know. Because $280 a month from the public option, do we know how much, on average, private insurance is in San Francisco?
I can't answer that figure. I don't know. I do know that with the cost of the program in San Francisco, the cost of the program to San Francisco right now is about $113 million this fiscal year. If we're talking about what's the price tag to San Francisco on this kind of coverage. What I think political leaders here, and Newsom has been one of them, have said is the preventive aspect of this is what they're looking at. When you can stop people ahead of time, when you can provide them with preventive care, keep them from going to the emergency rooms, then you're saving taxpayer money. That's, I think, the bottom line. I don't know how much that insurance would cost privately. But I got to say, this is something a lot of people around the country are watching when they're talking about the kind of what looks like a really landmark program that has happened here in San Francisco.
We're talking to Carla Marinucci from the San Francisco Chronicle. Carla, Gavin Newsom also said that Kaiser switched over to this, and I was a little confused by that. How does a health care company, to cover their own employees? Healthy what Healthy San Francisco does is, it creates a partnership. It's a partnership program. There's neighborhood health facilities, there's hospitals, there's medical homes, a whole network of groups that work. And what they do is give access to services within a certain geographic area of the city.
you know, I mean, this is one of the, I think, unusual and more creative aspects of this program, and I think it's something that bringing on Kaiser was a huge plus, I think, for the mayor in a lot of ways. I have to say, you know, it hasn't been without criticism, especially when you talk about who pays for it. The employers are paying for it. The local restaurants are paying for it with a certain taxes added on. Some of them say that has been, you know, the contributions from the employers have been about $2 million in total, and some of them, of course, say those kind of payments are putting them out of business. So far, we haven't seen a real study on whether that is happening, but the bottom line is you got 60,000 people in San Francisco that are uninsured, and you've got now the majority of them look like they've been covered by this program.
Okay, Carla, let me understand that side of it a little bit better. So he doesn't want to raise general taxes, so he's taking this out of specific employers. That's where the $113 million is being raised? Is
employers
that right?
And restaurants are paying.
Why restaurants?
I'm not sure why restaurants were targeted, but I will say that the restaurants aren't happy about being targeted. The bottom line is there's a business in San Francisco that employs a lot of minimum wage people, and I think that was one of the aspects of it. That it's a huge base. Many of the unemployed in San Francisco worked in the San Francisco restaurants, but the fact is that this has been challenged by Golden Gate Restaurant Association that say they may want to take it all the way up to the Supreme Court if necessary. In fact, it is possible that the Supreme Court will hear their case in September. We still don't know that, so this could be challenged. You know, you asked on the issue of Kaiser, and I'm not sure I finished answering that, but what we're to understand is Kaiser that provides primary, emergency, specialty, all kinds of services, and it kind of serves as one of these medical homes we're talking about for the Healthy San Francisco participants. There's groups throughout San Francisco that do this, the Chinese Community Healthcare Association, you know, community clinics and so forth. And that's kind of what is the interesting thing about it. Kaiser, you know, is an insurance plan, but they're going to be working with part of this program, and I think that was a huge coup in getting them on board.
Yeah, that's interesting. Now, the $113 million, I'm keep coming back to that. Is that subsidizing the lower premiums, or is in the long run are the premiums supposed to pay for the public option in and of itself?
I'm not sure I can answer that question. I don't know. I got to tell you quite honestly.
Okay, that's
I'm not
right.
an expert on the on the Healthy Family Program, but we'll try to get you that answer.
Okay, Carla, that's why I said in the beginning you might not know some of these things because we're all learning about it here. Because if it's not subsidized, then it's an amazing program, and obviously.
I'm looking at the latest assessment of the program, which says that the $113 million, that's revenues of $32 million and a general fund subsidy of $80 million. And based on that, that's the estimated per participant cost is $280.
So do we think that subsidy is something they have to put in every year, or was it just to get it started in the first year?
I believe that's an annual.
That's annual.
Yeah.
Okay. Well, you see, then I think that the conservatives might have a decent point, because if you're subsidizing it with tax revenue, then it does make it harder for the private insurers to compete with them, right?
Yeah, you're right. And in fact, I'm looking at the most recent study of this program. You asked about, what would these insurance plans cost if you did it privately? The estimates on that are between $388 and $618 a month. So San Francisco is doing it for $280.
Right.
So that's
that's
a huge savings.
Yeah, I wish they would do it without the subsidy, because then we'd have a good test case of whether a public option can compete with private insurance. I don't want to rig the field.
Yeah.
So that's interesting. All right. Well, look, it's an absolutely fascinating study of what can work and what might not work, and what
Yeah, totally. I mean, this is a laboratory case, and I think for a lot of reasons, people are going to be watching what's going on in San Francisco. And certainly, Gavin Newsom is running for governor of California. That's going to be a landmark election contest coming up in 2010. A lot of it may have to do with how successful this program is.
I hear you on that. So real quick, last question for you, Carla. On that note, what do you think his chances are?
He's got an uphill battle if Jerry Brown, who has been governor of California for 2 terms, runs again. He's fully expected to. He has about 8 times more money than Gavin Newsom. But Newsom's going up and down the state, establishing his name, getting to, being out there in town hall meetings. This is going to be a contest. A lot of people give it to Jerry Brown already, but it's California. You can't count anything out.
Yeah, you certainly can't count Jerry Brown out.
Absolutely not.
He just keeps coming back. I think he's going to run in the year 3000 again.
Yeah.
All right.
If anybody could, it would be Jerry Brown.
No question. Carla Marinucci from the San Francisco Chronicle, thank you so much for joining us on the Young Turks.
Hey, thanks for having me.
Thank you.